Hello again. Let's get right to answering this week's quiz question for you. Here it is. Weight reduction is the primary reason for liposuction. True or false? Well, the answer is false. If you're exercising and maintaining proper diet, but still find that some areas in your body don't lose fat, you and your doctor may consider removing that fat by using liposuction. However, that procedure is not for general weight reduction.
You're kidding.
No.
Wow.
Good.
If it makes them happy, I mean, there's nothing wrong with it. It's becoming a more common thing. It's more accepted. I would get it all done if I could.
You think it would be for weight loss, but now that, no.
So it's just get off the couch and try to work a little harder at it. My
So get off the
recommendation.
couch and start working a little
I'm not
harder.
on the couch. I'm walking around the mall.
All right, he makes a point there. However, when considering liposuction, it's usually for those who have been dieting and working out at the gym, or like him, walking the mall for a while and still aren't seeing the results they want. Are you left with a few stubborn areas that won't slim down no matter what you do? Liposuction may be for you. It's one of the most commonly performed cosmetic surgeries, and if it's something you've been considering, we've got a little more information to help you with your decision.
Dorothy Ward has worked hard to get her body to where it is today.
Several years ago, I had gastric bypass, and I lost approximately 167 pounds.
Although Dorothy was happy with her weight loss, she was not so happy with the way her body looked afterward.
After losing all of the weight, I got to a point where I was able to go back to Dr. Cian and have a tummy tuck. And at that point, I discovered that I had saddlebags on my thighs, so I talked to Dr. Cian about having liposuction on my inner and outer thighs.
Dr. Kenty Cian, a board-certified plastic surgeon, says liposuction is a common option for people with stubborn areas of fat they would like to lose.
Liposuction is by far probably one of the most commonly performed cosmetic procedures in the country, and I'd say probably in the world.
Liposuction is a cosmetic procedure in which fat is removed from the body through small incisions in the skin. Tumescent liposuction is the most commonly used technique.
We instill fluid into the area to be liposuctioned, and this fluid contains epinephrine and lidocaine, lidocaine being a numbing medication, epinephrine to constrict the blood vessels. Once we've infused that fluid into the area, and then we begin to introduce this cannula, which is a hollow tube with holes at the end that is attached to a suction device, a suction machine. And we just make multiple passes underneath the skin into the fat to try and loosen the fat, and in the process we're sucking out fat that gets dislodged. Any questions?
Liposuction can be done as an outpatient procedure under local anesthesia, providing the area being worked on is small. Larger areas may require the procedure to be done at a hospital. Recovery time varies, but most people can return to work within a few days.
There is some discomfort associated with it, but if I were to describe the discomfort that most patients tell me, it would be comparable to the way you feel the day after doing a workout in the gym, if you haven't gone to the gym in a while.
Compression garments must be worn for a week or more following the surgery, and it can take a while to see results.
You will start seeing the results, I'd say, starting about 3-4 weeks after, and as the swelling, as more and more of the swelling goes away, you will see a difference.
Liposuction is typically used on the areas of the body that are not responding to diet and exercise. It is not a cure for shedding a few unwanted pounds.
Ideal candidates close to their ideal body weight with areas who eat right or follow the proper dietary regimen and who exercise regularly. And despite that, they still have areas of fat buildup. These are the patients that would benefit most from it.
As for Dorothy Ward, liposuction helped her achieve the body she was looking for.
Just the fact that I could look nice in a pair of jeans, or wear a skirt without the bubble on the side. Yes, those were my convincing factors.
And with proper diet and exercise, Dorothy has been able to keep the body she worked so hard to attain.
And I would recommend it if someone has an area that they're absolutely can't get rid of working out at the gym, as I did myself, then yes, it's something that I would recommend.
It's important to remember that liposuction, as with any cosmetic surgery, is an elective procedure. You should have any pre-existing conditions such as diabetes or high blood pressure under control before you consider having your surgery.